Hi, everybody. This is Grady Phillips with Corporate Medical Services, coming to you from Chattanooga, Tennessee. In a few minutes, we're going to be talking about the FMCSA info for COVID-19, the FMCSA Clearinghouse, random testing, and more. We partnered with Nova Medical Centers to present this information via a webinar on March 25th, 2020, and we thought we would make it available for you on demand. Great to be here with everybody today, whether we're joining you in the office or the home. This is a serious topic. We are glad to be able to present some information. We hope that everyone is able to learn something as we go through this. So the key discussions we'll be having today are FMCSA and the recent announcements with regard to COVID-19, what's going on, at least up to the current moment of what we know. Then we'll jump into some random testing discussion, quick talks about how you can prepare your workplace, how to look forward for what is coming, the pandemic that we're all going to be facing soon. We'll jump into some topics on the FMCSA Clearinghouse. Basically, we will be just hitting the highlights on the Clearinghouse. We have a full-length webinar that we do discuss on that we have presented to several Nova locations. We still see a lot of need for information on there. But we are really trying to pack in the topics today. Lastly, if we have time, we'll go over some tracking software that we've been able to find that we think should be helpful for you and be able to show your staff, your family, your friends exactly what we're trying to accomplish with this slow the spread and flatten the curve concepts. Lastly, Q&A. Hopefully we'll have some time to get down that road. So we've nicknamed this talk the Everything But the Kitchen Sink. Basically, you can see with all the different points that we're going to be covering that it's a little bit of everything. Again, jump in. We're happy to handle any questions that we can. If there's something that we don't know, we'll save it. We will get back with questions. We'll reach out to all of our different experts that we deal with to be able to handle pretty much anything that you guys can question us. We always like to talk just a little bit about who we are and what we do so that you know the perspective that we're coming from. At our base, we are an MRO, medical review officer. We review drug screens. We're also a TPA where we facilitate, pay for testing nationwide, schedule it. We have consortiums for smaller trucking companies that we both operate of our own consortium and we manage for other companies as well. We have a 24/7, 365 post-accident service where nationwide we can solve any problems that you have. A comprehensive sleep apnea program where we do testing, therapy, and compliance, or monitoring rather. Our chief MRO is Dr. Joseph Sintef, who is also the chief medical officer for the FMCSA. We were incorporated in 1995, so we are rapidly approaching our 25th year in service as corporate medical services. And in that time, we've reported nearly 3 million drug screens. So that is what we do. That's who we are. So we'll jump right into the FMCSA discussion. So what we're going to try to communicate, there have been a flurry of different notices, policies, guidances, braille recordings, I don't know, from the FMCSA. They've all come from different angles. We're going to try to put all this together, and the best way that we can do that is with a timeline. So on March 14th, the FMCSA put out an emergency declaration. March 18th, they quickly expanded that. So we're not going to go over, you can see the asterisk on the emergency declaration. We're going to skip that one because the expanded covers everything that it did and more. A couple of days later, they put out a notice to the SDLA. Now, if you're not familiar with that, that's state driver's licensing agencies or your DMV, basically put out a notices to the states. On March 20th, they also put out a notice of enforcement discretion, which means they're not going to penalize or enforce rules for anybody trying to get a temporary operating authority. That's a little bit out of our purview, so we're not going to cover that one either. We can only pick so many things. A few days ago, 2 days ago, the ODAPSI, which is the Office of Drug and Alcohol Policy and Compliance, presented guidance on drug and alcohol compliance. And we'll spend a good bit of time on that one because this really is our subject that we're trying to make sure that people understand how it works and goes forward. And then yesterday, the FMCSA put out what we title the waiver. Now, this is, we had a big question in the last webinar where somebody asked, how can I find the waiver? Well, if you Google FMCSA waiver COVID, boom, it'll pop up. Don't do that now. We're on a webinar here. I know somebody jumped. Don't do that. Just kidding. And then again, yesterday at the same time, they put out another notice of enforcement policy, which we'll get into. And then lastly, we'll talk about some state actions. So that's for this subject. Here we go. The expanded emergency declaration that they put out on the 18th. What that does is it exempts drivers and companies from FMCSA for Federal Motor Carrier Safety Regulations, Part 390 to 399. Those of you who don't have those memorized, what that basically means is hours of service, maintenance, inspection, general driver qualifications have been suspended. In other words, just get out there and drive. Don't worry about how many hours you're spending. Don't worry about how many miles you're driving. But That's only for carriers providing what they call direct assistance. Very specific, and it's spelled out in this declaration. Direct assistance is providing medical supplies and equipment for testing, diagnose everything for COVID, for supplying and equipment necessary for community safety, sanitation, prevention of transmission, also food, paper products or groceries, immediate precursor raw materials such as paper, plastic, alcohol that are required to be used for these items, fuel, equipment, persons designated by local authorities, state, federal authorities to help with the medical quarantine or isolation of people, and people necessary to provide other medical or emergency services. So it's very specific what you're doing. It spells out this does not apply to routine commercial deliveries. If you run a normal route and you're doing it's not direct assistance, and you really don't want it to be. We'll get into that in the next couple of bullets here. Specified direct assistance terminates basically when you stop providing that special only assistance. So if you go back to doing traffic, or if you get back to your terminal, that's when it stops. When it stops, the driver has to be given 10 hours off duty, or at any time, if that driver says, I need immediate rest, you have to give them 10 hours off of duty. Once they report to normal operations, they have to be given that 10 hours off duty. Or if they're hauling passengers, it's 8 hours. Why that is, I don't know. It specifies, now remember, this was back on the 18th, so some things changed between here and there, but it specified that drug and alcohol testing, license requirements, insurance, hazmat regulations, and size and weight regulations still apply. So that was the end of that one on March 18th. It does make a point that this is not new. You know, the federal government, although we've never seen anything to this level in our lifetime, there are regulations that talk about relief from regulations. Specifically, this 390.23 discusses how they would do this. And, you know, we're in the South, so anytime there's been a tornado or hurricane, you see some level of this relief from regulations that the DOT does. Obviously, it's on a grander scale than anything any of us have ever seen before, but, you know, they're working off of the backs of our, the people who came before us, basically, not having to reinvent the wheel. So then on the 20th, the FMCSA put out a notice to the SDLAs, the state drivers licensing agencies, and they told them that, hey, you know, gloves off, we're not going to hold you in non-compliance if you extend the licenses for CDLs and CLPs. Just so you know, CDL, commercial driver's license, a CLP, commercial learner's permit. We use that a lot as well. So a SDLA, it should be an SDLA, may allow a CDL, CLP to be renewed online. The FMCSA will not hold a state in non-compliance for not downgrading a CDL, CLP during the emergency. Now, a lot of people don't understand the relationship between a license and a medical certificate. And we'll get into that a lot as we go, but just at a basic level, most of us have a driver's license. That driver's license has an expiration date. A CDL is no different, same thing. A CDL also has to have a medical certification. Now, we have a lot of OCMED people here that know what we're talking about, but that medical certification is a part of the license. So if that expires, typically your SDLA will either downgrade or mark you as not certified based on not having a medical clearance. So what the FMCSA is saying is, hey, if you fail to downgrade them, now remember this was 5 days ago. So if you fail to downgrade them, don't worry about it, just keep on rolling. But it's clearly spelled out that states are expected to promptly bring practices back into compliance after the emergency is over or the state becomes able to function. So then 2 days ago, ODAPSI. Now, ODAPSI is the office. Well, we're going through a lot of acronyms here. We might need a glossary at the end of this. ODAPSI is the Office of Drug and Alcohol Policy and Compliance. We talked about them earlier. They are not a department. They are you might say that they are a advisory committee, but they are the ones that are responsible for what we all know as Part 40, which goes into how all drug and alcohol testing is performed. They put out a guidance letter on 23rd. Yesterday, FMCSA put out a guidance letter to which they referred back to this one. So this is kind of the meat of the discussion. In effect until May 30th, it specifies this is not a new law. All we're doing is clarifying the existing requirements. So as a DOT regulated employer, you must comply with DOT training and testing requirements. That's it. However, they realize that, you know, as this virus spreads, as scarcity of service agents actually will happen from place to place, that may not be possible everywhere. So what they expect you to do is to make a reasonable effort to locate testing services. You should consider mobile collection services. They call it a best practice. Makes sense. You know, have them come to you where you're not going into a medical clinic. If you are unable to conduct testing due to COVID-19, you have to document why that was not completed, including your reasonable efforts. And you have to note that they note that some testing can be completed at a later time within regulations. So for instance, you have a DOT reportable post-accident and you cannot accomplish the DOT, let's say the breath alcohol within the 8 hours and the drug screen. You can't get somebody to get that done. Well, although the breath alcohol may expire at 8 hours, you still have a total of 32 hours to get your drug screen completed. And so maybe in the morning, maybe at a different location, you can still accomplish that. So, this is not a get out of jail free card. This is really make a reasonable effort. And at some point in the future, when you get audited, then the DOT will take that into account. Now, this is the first time, but not the last time, I'm going to make the comment that there are lawyers out there looking for people who missed doing this right. So keep that in mind when you do these things. Look at these regulations, make sure you document, make sure you have what you're doing. If you can't get it done, you can't get it done. For our clients, if they ask us to schedule that, we have a process whereby we contact every clinic within typically a 35-mile radius. We document all the ones that we tried, and if we can't do it, we write them a third-party letter saying that we made all reasonable efforts. So, something along those lines. If you have inside staff that can do that, that's great. If you have a third party that does it, that's great. Specified on this DOT guidance is you must continue with existing regulations. So for instance, if you hire somebody, you cannot put them to work without a negative pre-employment test. That only makes sense. All of these regulations are still in place. You just, a little bit of common sense, a little bit of effort. They do want employers to review their DOT requirements to allow, like we said, for a later date collection if you're doing a post-action or something to make that done. They also spell out, they know that a lot of drivers will be concerned with their potential health risks. If you put them into a medical clinic, if you send them someplace where there are a lot of infected, there's a reasonable assumption that, they may not want to go into there. But again, they go over this detail. It is the employer's responsibility to determine what is and is not a refusal under DOT regulations. So although you might very well have a driver saying, look, I don't feel safe going in there, you might also have a driver that uses that to their advantage. It's possible. And so it's up to you to make that determination. So if you're wherever you are in safety, either need to look up the ladder, look down to people below you, and figure out exactly how you're going to handle that situation. Like what questions are you going to ask to go down there? One thing that this guidance does specify is that employers should verify that clinics or collection sites have minimized the risk of exposure before you do send your driver. So that is a pretty clear cut. If you contact a clinic and say, hey, are you open? First of all. Second of all, have you taken reasonable precautions? What should my driver expect when they come there? Is there a back entrance that does not go to urgent care? Are you somebody like Nova that is 100% occupational medicine? Are you whatever other type of clinic that's out there? To get that done. Just have that conversation and try to move forward. So that's the end of that one. Yesterday, the FMCSA put out the waiver that we've talked about. Now, the waiver granted to all states, SDLAs, CDLs and CLP holders, and interstate non-CDL holders, basically anybody that's under their purview. If you have a license, they will allow the state to extend that license up until June 30th if you had a valid license on February 29th. That's not a typo. Remember, this is leap year, so it's just interesting that on leap day is the date that they pick. So it's easy to remember. So on leap day, if your driver, that's a leap. I'm sorry, that's a dad joke. All right. So on leap day, if they had a valid driver's license and it expires somewhere between March 1st and June 30th, the DOT will allow the state to extend it all the way up to June 30th. Now, if you've been paying attention, you might remember that a few days earlier, the DOT told states, hey, we're not going to penalize you if you just extend them without a clear-cut answer. And so a lot of states just did that. Tennessee, our home state, just extended driver's licenses 6 months. Well, in light of this new guidance, I think that they have come back and have a new executive order refreshing that back to the June 30th that the FMCSA has given them. So there's a lot of back and forth, a whole lot of noise, a whole lot of commotion with these regulations. Hopefully we are clarifying that a little bit for you by giving the context. This waiver also waives the wait time for a learner's permit to take their skills test. There's a mandatory waiting time, and that's been waived. Their goal is to get more drivers on the road with the same level of safety that they had without getting that done. So this waiver also waives expired medical certifications, again, if the driver had proof of valid certification on leap day. Now, what is proof? There's been some discussion what actually stands for proof, and we'll get into that in just a second. I think that we can answer that question. Additionally, it waives the requirement for drivers to submit their medical certificates to the driver's license agency. So if you're in this business, you know when a driver gets a physical, they have to either take it, fax it, email it, whatever, to their state to update their certification to verify exactly, basically upgrade their license. And they are saying, the FMCSA is saying drivers do not have to do that because most of them are closed, honestly. Lastly, it waives the requirement for the state driver's license agency to change the certification status, either not certified or to downgrade. So keep in mind, this is the FMCSA saying, hey, states, we're not going to punish you for doing this, but there's a lot of state power in there. So the restriction of this waiver, if a driver has a suspended or withdrawn privileges for traffic offenses, obviously they can't be covered under this waiver. A driver must carry a paper copy of the certificate. We say with the waiver, the waiver doesn't say you have to carry a copy of it, but it only makes sense. Print this out. Now, this is for drivers that expire during this 3-month period. Remember, this is not for everybody. It's not for your entire fleet. It's for a driver who is expiring and you've made the decision, or due to circumstances beyond your control, you cannot get a new physical during this time frame. Still, best practices are if they expire their medical certificate and you can get to a medical examiner, get them a new physical. It only makes sense. You don't want to wait till June 30th when the rest of the world is trying to get physicals and trying to get into driver's license agencies, or perhaps they'll extend it. Let's try to avoid that if you can. So this is only for people that really need it. If a driver cannot provide a copy of that certificate, they're not covered under this waiver. So, you have to look out for that. A driver who has developed a disqualifying condition, that's a hard one, but should a driver have developed something that may potentially be disqualifying, or somebody that requires a skills performance evaluation, those are rare, but a lot of people know them as SPEs, any of those, then they are not covered under this waiver. And any medical certificates that were originally made for less than 3 months. So if you have a 1-month physical, a 45-day physical, whatever, you are not covered under this waiver.
Grady, we got a question here.
Hit me.
Should we print this waiver and place it in each driver's DQ file?
It's not a bad idea. There's nothing in here that says that that's the case. And if and when you do get audited in the future, auditors should know this information, but it never hurts to have a reminder of exactly what was going on during this time frame. Do recommend that any drivers that have expired licenses, that they do print this and carry it with them, even though, again, that's not specifically required either. One other condition that this waiver goes over is anybody who is operating under this waiver has to report accidents to the FMCSA at this email address. And again, we're going to be sharing all these links with everybody. Don't worry about taking notes or writing all this stuff down. We'll be happy to give you whatever we have on all of this stuff. We are all about communicating. Lastly, FMCSA can revoke this waiver, if you don't comply or don't report an accident or whatever. And to the point about the states having the power, this comment that the FMCSA will not issue a finding of noncompliance to the states if they do or don't do anything with this waiver. So the FMCSA is saying, we're not going to punish you if you do these things, but we're not going to punish you either way. And so if you read this, this was clearly written by a lawyer. And the lawyer that I give credit to is the guy that signed this, Jim Mullen, the acting administrator for the FMCSA. Great guy. And I think that he is definitely looking out for states and for carriers by putting in these disclaimers that basically are trying to be flexible, but not create something for, prosecuting plaintiff attorneys down the road to be able to action on if at all possible. So really happy with what they've put in here and what they've tried to say. Lastly, check your state. Simply by giving the states power doesn't mean that they have taken action. We expect that they all will, but you got to be careful. If you're a large carrier, if you're somebody that deals with a lot of different licenses, drivers have different licenses, make sure that that state has taken the correct action. So on the same day that they put out this waiver, they put out a notice of enforcement policy on expiring licenses and medical certificates. And if that sounds familiar, you're not alone. It's very similar. It takes a lot of digging in to figure out exactly what they're trying to do here, because it says very similar information. The difference is this. The FMCSA allows a state driver's license agency to grant a license for up to 8 years. And that waiver covers you. If your license was up to the total of 8 years, they give you up until an additional June 30th, whatever that difference is. However, if you are in a state that only does licenses for, say, 5 years, you are not covered under that waiver. They realize that. And in the waiver, they actually say, hey, we're going to be putting out a different notice for the people who don't have an 8-year driver's license. And this basically says the same type situation. if you had a license and medical certification on leap day that expires somewhere between March and June, they're not going to take any enforcement action on you. Get them on the road, let them deliver freight, let them deliver people. Let's keep the country rolling. So I think the FMCSA is proving what we are all learning, that trucks, well, we've done it for a long time, but I think America is learning that trucks make this nation go. Okay, moving on to state actions. Now, this was good as of the 23rd, that there were 37 states that have issued emergency declarations, changing very rapidly. Don't believe that this is current right now at all. I'm sure there have been more and things have been changed. Most of the emergency declarations are very similar. They waive the hours of service that we talked about with the emergency declaration for the feds. The states just kind of echo it, that, if they had any regulations on that, they're waiving them. Most of them say that no ill or fatigued driver shall be required or allowed to operate a commercial motor vehicle. Some states talk about the driver's licenses in these emergency declarations. Some of them have different directives that they go by. One group that we're a member of, American Trucking Associations, is tracking up to the minute state updates on COVID-19. They call it their COVID-19 hub. Again, we'll give you that website later. You can, Google ATA COVID-19 hub and it should pop right up. I have noticed that a couple of states that have put out very recent changes are not yet updated. So it's not exactly real time. I'm sure they have a staff of people who are following up, trying to get this done. So, you can't absolutely trust that it's absolutely current, but they do typically put links in there when they have new information. So at least you can go to the source and bless them for really trying to get the information out there, because this is where the rubber hits the road, quite literally. The states are the ones that grant the driver's licenses and that downgrade you if you don't have it. So the feds can fine you, they can shut you down, but the states are the ones that can keep you off the road. All right. Getting out of the COVID-19 just for a minute, let's just talk about the regulations that you still have to do. So random testing. Now, we at CMS put out guidance for COVID before the federal regulations came out, just telling our clients, look, you might not want to really push the random testing for the next couple of months. The FMCSA regulations specifically say, quote, spread reasonably throughout the calendar year. Now, some DOT guidance says you should do it at least quarterly, but the actual regulations is spread reasonably throughout the calendar year. And I think if we are ever in a sense that we can say reasonably, we might back off a little. Now's the time. So CMS suggests, and this is us, there's no official guidance to do this. Matter of fact, they won't come out and say it, that you might reduce or eliminate your entire selection for the next month or two. The key is don't tell your drivers. The whole goal of random testing is a deterrent effect. We're not trying to catch anybody or punish anybody or get them off the road. We're just trying to make anybody who might be on the edge of, well, maybe I should smoke this to make me feel better with all the stress I'm going through, that they realize they might be selected for a random test. So, as far as they know, the testing is still going on. And, if you're in a position where you can do your random testing, keep it up as normal. But if it's in a situation where it makes sense to, not stress out the medical providers a little bit, then, go from there too. Remember, by the end of the year, the FMCSA requirements are increased this year. You do have to test 50% drug and 10% alcohol for 2020. That's the FMCSA regulations. And so, you can catch up on the third and fourth quarters to make sure that you're compliant.
All right, Grady, we got a question.
Yes, ma'am.
If we are wanting to use a driver who has had a lapse in service of more than 30 days, can we use their original pre-employment test to put them to work if there is a problem getting a new test?
So there's no regulation on that. It's a good, tough question, but there is a question and answer that is in the DOT regulations and Q&A section that basically says if they're outside of a random testing pool for more than those 30 days, you should do a pre-employment test on them. The answer probably should be no, you should accomplish that pre-employment test, because they are specifying that the regulations are still in effect, therefore the guidance is still in effect. And they do, that illustration was not one that we came up with. It actually was spelled out in that declaration or that guidance from ODEPSI, that you do have to have pre-employment testing done. So I would argue no. You might find somebody that said something differently. It's a good question though. All right, let's talk just a second about service agent availability. As transportation service companies, we are considered essential functions, do have a duty to stay open during the emergency, but testing always takes a backseat to treatment. So if it's a medical clinic that you're going to, it's entirely possible that they are overwhelmed with people who need emergency care, and they may say, I don't have time to handle your testing right now. We are monitoring our collection sites nationwide for our clients. Definitely encourage all carriers to do the same. However this works, communicate. If there's a word to take out of this talk today and go forward, it's communicate. Make sure that you get above the noise. Make sure that you know what you're doing. Maybe have a backup plan. The most common thing that we are seeing are clinics that are not doing the breath alcohol test. Breath alcohol test, if you are not familiar with it, the driver has to blow forcefully through something that's about the size of a drinking straw. And typically you blow directly at the technician, the way that those are set up. And so, a lot of people are definitely concerned if you're certainly within 6 feet and blowing forcefully at somebody's face, that can see that to be a problem. We've reached out to ODAPSI to consider extending the oral test strips. There's something called an STT that you can use for the screening. If it comes back as presumptively positive within DOT regulations, you still have to confirm it with an actual breath test. You don't see that many positive breath alcohol tests. We're trying to see if they can do something different to get there, but that's what we're seeing right now is trouble getting those done. The second most common problem that we're seeing are doctors who have set appointments for their DOT physicals that might have been a walk-in before now. They're saying, look, I have limited time. I still want to take care of the industry. I still want to make sure the trucks are rolling, but I need to limit it just a little bit. So there is a potential for MRO TPA closings as far as overall service agents. We haven't heard of that yet, of anybody that's going on. There's nothing, certainly, most of the larger ones have backup plans and have essential business plans in place like we do. But if you're dealing with somebody that may be a smaller clinic or, single doctor, you might find out what's your backup plan? And if they don't have a good one, have one of your own, just to make sure that you are covered, that you don't get left hanging. And we'll get out of this section with a quote from the president. If you work in critical infrastructure, you do have a special responsibility to maintain your normal work schedule. So that applies. I don't think it's a stretch to say that everybody listening today doing a good job, working really hard to get this going, to make sure that we provide for the country, and just appreciate everybody that's out here doing that. Okay, takeaways for this portion of the talk.
There's a quiz at the end.
Is there a quiz? Oh no, I'll probably fail it. The FMCSA seems to be relaxing as many rules as they possible without breaking any. Their goal is to keep as many trucks on the road as they can without, their job is to provide for the safety of the public, and that's what they're trying to do as much as possible and get people out there. So as an employer, be mindful of when and where you require drug testing to be performed. Reach out, communicate. Anybody that has a license or medical certificate that's going to expire in the next 3 months will most likely be able to be covered where they can continue to operate, but it's going to be a maintenance headache for your safety department. So check your state, make sure what is being allowed there, make sure it's good. Like you said, document, probably getting the DQ file. Never a bad idea to have too much documentation. Okay, let's talk about your workplace for just a minute. Now, we're not OSHA experts. We are, MRO TPA. We do have some medical background on this, but you certainly want to take this to your company. If you're a larger company, make sure what plans you have. But there is OSHA guidance that they've put out for preparing your workplace for COVID-19. That's a link that we'll have at the end of this and be able to share with everybody. They recommend you develop an infectious disease preparedness and response plan. By the time I finish reading that, I think that I could already have a plan put together, but if you go look for some of them online, they're several hundred pages long. But I think any plan is better than no plan. Put something together, and there's just a couple of suggestions here below. Make a point to implement basic prevention measures actively. And when we say actively, we mean email, call, tell them, don't assume. We have a tendency in this culture and in this industry in particular to tough it out. This is not the time to tough it out. If you're sick, you stay home, because you are going to do a disservice. It's about being safe. I'm talking about drivers. I'm talking about, collectors. I'm talking about everybody. That's what you want to do. If possible, if you're in a larger corporation, stagger your work shifts. Have some or all your people remote work. You guys know this is what we're already doing. Hopefully the whole country is taking the advice to do the social distancing. However, there are some people that just don't get it. Go over that with them. Tell them what the point is. Go over the respiratory etiquette. Cough into your whatever you have. Don't just spray it all over the office. I have to admit, I sneezed this morning, and within 2 minutes a box of Kleenex magically appeared on my desk. We're about 70% remote working here. We're capable of 100% remote work, but we have everybody in different offices, definitely spread out, and yet they ventured it that I didn't need to be putting a sneeze across the office. So anyway, one thing that a lot of companies are doing, and this is something when we put this together, this was only for visitors, but as we have understood now, SHRM has actually approved this. We're taking some drastic steps to screen people coming into your office. You know, these are CDC suggested questions. What we did is we found several of our suppliers and our companies that were putting this together. We picked the best parts. We came up with this form. We're more than happy to send you a copy of it. We'll even customize it with your logo and put your information at the bottom of it. Basically just asking a handful of travel related, safety related questions, and then taking a temperature of your visitors was the original goal. But as we understand it, again, we're not experts on this, that the EEOC and SHRM and the ADA have now approved, because it has been declared a pandemic, that you can also use this on your employees. Historically, that's a big no-no. Historically, you don't test your employees because it's considered a medical test, but we understand this is crazy times. Again, that's our take on it. Make sure you look at that.
And Grady, one thing to tie into that is just the importance of, if you do capture that data for your employees, you will treat that as HIPAA, as personal private health information. So you want to keep all of that information separate from their personnel file. So that would be information that would go into their medical file. That's
an excellent point. Yeah, confidentiality is what it's all about here. One other thing that they recommend you do is just to look around your office, look at where exposure could happen, and do your best to reduce it. You know, elimination and substitution, looking at the image on the left there, though we can't do anything about that with this particular hazard. But you can look at your engineering or your environmental controls, engineering controls on the image. You can put in HEPA filters. You can increase ventilation at the office. You can make sure that it's not a warm, moist environment where viruses, bacteria tend to thrive. Put people in the best position that you can. Administrative controls include spreading people out. Don't go to meetings. We're doing most of this already, but these are the things that they just recommend doing. Practice safe work practices. One thing that we've started working with people is, 6 feet. A lot of people have trouble determining what is 6 feet, but if you stick your arm out and the person that you're talking to sticks your arm out, if your fingertips cannot touch, you're pretty much at the safe distance from each other. It just gives them a good frame of reference to go down to really reduce the spread of this virus. And if somebody's too close, you can stick your hand out, and if you poke them in the eye, that's their fault. Don't do that. I didn't advise that. You want to have a plan for what happens if a driver tests positive for, say, COVID on the road, or to one of your employees in your office. Now's the time. Hopefully you haven't had anybody that has tested positive yet, but be ready when it does. You don't want to do this on the fly and make big mistakes. Remember those lawyers that are out there. Personal protective equipment, that sounds great. We already know that we have a real problem with that, with the supply in our workforce right now. And from what I understand, there's to be several good talks upcoming. I know Nova is putting one out tomorrow.
Yeah, we've got 2 going on tomorrow. For respiratory alternatives with N95s.
Excellent. And so the response, and for what it's worth, I hate this image. I've seen that fur ball so many times. I'm so sick of this virus. I'm like some other people. I'm ready just to get back to work, but we have to do what we do. Again, we're not lawyers. We're the ones that are looking out for lawyers all the time. So what do you do when an employee gets sick? First thing, I just realized we misspelled this stimulus package. We have a stimulus package that's coming soon, apparently, but it's going to detail a lot of how you can let people stay at home and what will help them to get going. But one thing that's important, according to all of the OSHA and preparedness documents that we've seen, you treat suspected and confirmed cases the same. You don't wait till somebody tests positive. Most tests that are out there are taking 48 hours. There's some that are less. There are even some instant tests that are under development, but if somebody has symptoms, just assume they have it. It's the safe thing to go. If the infection happened at work, and this is a whole OSHA, did it happen at work? With all the pandemic stuff, you're not going to be able to prove that. But go ahead and reach out to your workers' comp, see what their role is going to be in this. Outside infections, if it's not going to be related to work, does the employee have FMLA? Do they have leave time saved up? What's going on with that? So the thing that you want to do once you do have a confirmed case or a suspected case that you close enough to being confirmed, is you make sure you notify correctly. And this is back to what Megan was saying about the confidentiality. You're allowed to ask the employee if they grant permission to disclose their name. Half of the country is going to get this. It's not an embarrassing thing. You're allowed to ask them, and they're allowed to say no. But if they tell you yes, that you can disclose their name, you can go to their supervisors and tell them that this person has been infected, may or may not have it depending on the situation, and tell them to take all the precautions necessary. You tell everybody else that the person is on leave for non-disciplinary purposes. If the employee says, no, I don't want you to tell everybody that I have this, You just tell the supervisors and employees and everybody else that the employee is on leave for non-disciplinary purposes. That's all. That's the way you handle that. Regardless whether they tell you yes or no, it is your job to identify either to OSHA or your health department that you have a confirmed case. Now, as we go on, a pandemic increases. I'm sure that, once you report the first one or two, they'll probably give you guidance on how to handle more, because from all understanding, there's going to be a lot of these no matter where you are in the country. Go ahead and line up your cleaning. A lot of these, I think Megan was saying earlier, there's a suggested 24-hour wait after cleaning. Make sure, get with a cleaning company, somebody certified to do this work. When that happens, it's never too late. If at the very least, make sure that you have a really good cleaning regimen to do the best that you can to stay as safe as we can for as long as we can. Do worry about discrimination. Do worry if you do not disclose these people's names. One thing that we're clearly seeing out there is a discrimination against Chinese Americans, Chinese people here. It's not their fault. It's not anybody that you're seeing. We don't discriminate. We don't allow that. We're better than that. And so do proactively communicate to people. This is a problem that we are all facing together. It's not time to point fingers. That's what the lawyers do later on. Sorry. If there's any lawyers out there, please forgive me. There's some good ones. All right. Keep in mind, ADA. And so if the person calls in, you're allowed to ask them if they have flu-like symptoms. Again, keep it confidential. The whole thing about reading thermometers, when we wrote this, it was a medical exam to test employees. That's changed. It is now a pandemic. You are allowed to test employees. At least that's the way we understand. You are allowed to ask them about their travel, even if it's personal. Where'd you go? And that goes back to that screening form that we showed you earlier. You can ask them, have they been outside the country? Where have they been? If they've been to a quarantine hotspot. You cannot require them to disclose other medical conditions that, may complicate COVID should they get it. So you can't say, hey, do you have diabetes? Do you have a heart condition? Do you have whatever? That's against the rules. But if they tell you, if they walk and say, hey, I've got this situation, you can discuss what type of help they think they may need. If somebody is absent from work, you're always allowed to find out why they don't report for work. That is not related to COVID. That's just an availability for employers. You can ask them, what's going on? Why aren't you in? Is COVID a reportable workplace illness? Yes, this is something that you are to report to OSHA, even though there is no standard covering it at this point. It is so new that everybody is scrambling to come up with the right answers. It's still under development, but it is, especially if you can prove that it was acquired at the workplace, it is a reportable situation. But let's take a pause and just see, I know we've covered a lot of stuff. We've got a whole bunch of questions, trying to make sure that I'm respectful of everybody's time and finish on time, but maybe we've got a couple that have popped up, Megan.
Yeah. If an employee calls in sick, should we require more details, and should we tell other employees?
No, you don't tell your other employees. You can ask them why they're off sick. You ask them if they're having flu-like symptoms. You can, ask them, say, are you showing symptoms, flu-like symptoms, and very specific about, what they're dealing with at that point.
If you have an employee that travels overseas and was initially not allowed in the country because of COVID-19 and is now here, should we have them wait the 14 days before returning to work, or have them provide a release?
Well, I would say, a few days ago, a week ago, you cannot require them to do that. But that is a question we probably should research and get back, because it being a pandemic, you might have heightened authority in order to protect your workforce to make sure that they do meet the quarantine. You can ask them if they've been told to quarantine or self-isolate. And if they say yes, then it's not a stretch at all to say, well, when you are not told to fall underneath that you should, then you can come back to work. Especially if they have the ability to remote work. Now this, just because somebody is positive for this disease, not everybody is going to get extremely sick. The numbers we've seen, 80% of people will not need any therapy, not any medical care. 15% will need some, and only 5% will need ICU. If you can work from home, this is the business owner in me. We tell people you can work sick. How sick are you? I know that goes against what I said earlier, but as long as you're home and you're not affecting anybody and you can get something done, work. We're going to have an economic shortage in this country of people being able to get stuff done. So I think it's time to step up and really try. All right, moving on. Let's talk about the Clearinghouse. So, a month ago, this was the hottest thing on everybody's mind. They wanted to know all about the Clearinghouse. We give a regular hour-long talk just on the Clearinghouse today, because we're trying to put everything in together. We're just going to hit the highlights, the frequently asked questions. We will spend a second going over everything, talk about registration issues, driver verification issues, the CCF requirements, talk about reporting, and then cover the documentation. Quick overview. What is the Clearinghouse? Most people know this. Forgive me if I'm starting too basic, but we have a lot of people still that wonder, all right, what goes in it? It's a database for violations. It's not every drug screen report. It's not every, they don't care who works for your company. They're not looking for employee lists or anything. It just stores the violations. Those violations are positive refusals and what they call actual knowledge. It also stores some return to duty process after somebody has had a violation, how they get back into good graces with the FMCSA. Some of that information is stored there. Those violations stay visible for a minimum of 5 years. So if a driver goes through an SAP program within those 5 years, well, at any point, after any new employer that they go to for those 5 years will see that violation on their record, even if they're back in the good graces, if they've completed their SAP program. After 5 years, that disappears off of what employers see. Now the FMCSA will see it, as far as we know, forever, but that information goes away. If the driver does not go through an SAP, it stays on there forever. And so this is a huge change for people. Currently, or last year, if somebody failed a test, they could just disappear for a few years and then come back and tell a company that they haven't driven in several years, and it's hard to go back and track down any violations. Although there were really, really big issues with registration in the beginning and all kinds of stuff, they still had over 8,000 violations reported to the Clearinghouse in the first one. That's 8,000 drivers off the road. That's huge. That really is a success. So it is working. It's doing what it was designed to do. Why do we need it though? Well, the big thing they tried to solve, the loophole, was that if a driver tested positive for pre-employment, they might go down the road to the next company, to the next company, to the next company. And we as an MRO saw that. We might have several trucking clients in the same area, the same street even, and we would see a driver that tested more than one positive. They may very well, be hired on when they got to sneak in some synthetic urine at one, or stayed off drugs just long enough to get a negative test. And we as an MRO are regulations prevent us from going from one employee to the next and telling them anything about a different employer. We would tell the FMCSA, but they didn't really have a whole lot of tools to fix it. This really helps close that loophole of keeping those drivers off the road. The Alcohol Clearinghouse is currently only for FMCSA. There's talk about other modes, maybe FTA, FRA joining in with it, but that's not happening yet. By far and large, the biggest number of issues with registration are not with the Clearinghouse itself. They're with something called the portal. The portal is something that is designed to be a single sign-on for FMCSA, for federal, state, and industry users, enforcement in particular, to be able to communicate with inspections, be able to see any accidents that you've had, any enforcements that you've had, and it's linked to the Clearinghouse. But they forgot to tell anybody that it was part of it when they sent out all the information on how you were going to register with the Clearinghouse. And nobody told the portal that they were going to have a few more million users. So it is having crazy, the website says intermittent system-wide outages, but it's not. It's broken. We have 50% of the people that we work with have trouble getting through the portal. I don't have a whole lot good to say about it, but I know that they're working on it. They put some money into it. They're trying to fix it as fast as they can. If you are able to get into your portal, you have to enable a role. And if you can do it, it takes about 30 seconds. You just check this role, the DACH motor carrier admin. Once you do that, you can go to the Clearinghouse, you link the enforcement, everything's lovely, and it all works great, and it's roses all the day. But it doesn't always happen. Now this is important. If you're not in the Clearinghouse yet, there is no DOT regulation that says you must be registered for the Clearinghouse. You are not out of compliance simply by not being registered. But if you're going to hire somebody, or at some point during the year when you have to do your annual query, if you hire somebody, you have to run a query, that's a problem. If you put somebody in the seat of a truck without running a query, you have a problem, and you will have a problem. So what they advise is you can sign up for the Clearinghouse and skip the portal. And if you need help with this, first of all, CMS offers free assistance to anybody on this. Doesn't have to be a client. We don't do a soft sell or hard sell or anything. We just offer this because we think that people should be doing this. It's a safety thing, and we're serious about safety. So feel free to jump in, give us a call, give us an email. We'll get to you and help you get through this. But the goal is to run those queries if you hire somebody.
Great. We have a question.
Yes, ma'am.
We operate some Class C less than 26,000 box trucks, but are a CMV. Do non-CDL Class C drivers need to register?
That's a good question. So, different states may give you different answers on that information. We had this discussion just the other day. What determines your drug and alcohol needs? Is it 10,000 pounds interstate? Is it 26,000 pounds intrastate, interstate? Where does it work? It boils down to this. when you hire a driver, if you have to reach out to their previous employers to look for any violations, then you should be registered in the clearinghouse, because that's what this does. This whole clearinghouse is designed to replace the question and answer to previous employers in the next 3 years when it's fully functional. So let that be your barometer. If you're doing that, then you need to register in the clearinghouse. All right, so what you see here is the beginning of a query. You type in, now this is from our perspective, so you can see this arrows along the top. First thing that a TPA has to do is pick which employer we're dealing with. But once you do that, this screen is the same for carriers or whoever. You enter in literally first name, last name, date of birth, and CDL number and state and county, and hit verify driver information. That reaches out to the CDLIS, the CIDLIS system, Commercial Driver's License Information System, verifies that it knows who that is, and then you run the query. Now, I tell everybody, full queries are required for pre-employment. And again, if you don't know this, our website has a lot of information for the clearinghouse. We've got some recorded webinars. We do these live. This information's out there. We're just trying to hit the high points. You do have to do that annual query for all drivers. We tell everybody that a query is kind of like a game of baseball. There's a pitcher and a catcher. So a full query, the employer is the pitcher. They start the query. They type this in. As soon as they hit verify driver information and pick whether it's a pre-employment or whatever query, it starts it. If the driver is registered in the clearinghouse, they should get an email. At the very least, when they log in, they will see a query pending that they have to say catch or consent to, big green box. Both sides must have a verified CDL to make this work. So big problem that we see are clients that type in a CDL that won't verify. The best information there is to make sure you look for leading zero. So if you have a driver's license number 1234, if you look at the actual license, it may be 0001234. That cures the vast majority. There have been some issues with certain states not working for a little while, intermittent issues with the CIDLIS. I know the actual clearinghouse went down for a couple of days, a week or two ago. They're going to have continuing small issues, but by and large, you can get people registered that way. If the driver doesn't see the pending request, remember, they also have to have the correct CDL verified. That's the link between the pitcher and the catcher, so to speak, is having that verified. So make sure that they log in, that they have verified their CDL. Once you do that, the queries work pretty well. Assuming that works, again, look at that screen on the left. That is all you have to do to start a query. So be wary. There are some people out there that are offering to sell you queries, that are offering to get you registered in the clearinghouse for a fee. Those are scams. Report those. We've reported 2 or 3 of those to the clearinghouse folks. They're pursuing legal action. But there are plenty of good CTPAs out there that are offering to do these queries for a fee. A few bucks, whatever. Now remember, you have to pay the government $1.25 for these, but a CTPA may offer to do it for a few more bucks. But that screen on the left is what they're doing. If that takes you a minute, I would be surprised. So is that worth, you could do 60 of those an hour, that'd be $180 an hour. You would probably take that job if you were offered it. But anyway, so just be mindful of what you're paying somebody else to do.
All right, we've got a question from Julie.
Hi, Julie.
Once you have completed a limited query, how do you then conduct a full query?
Not sure if I understand that question. So a full query is required at pre-employment, or if a limited query shows some type of information. So you do a limited query at some point during the year on all of your drivers. So it's required annually, but you can do it more often if you want to. A limited query, you're supposed to have we don't necessarily have enough time to get into all the details here, but you have a signed consent form outside the clearinghouse, and then you can run these limited queries however often that signed consent allows you to run those queries. The driver does not have to log in and say yes to each one of those. Now, if I do a limited consent query on Megan, and Megan, unbeknownst to me, and maybe even unbeknownst to her, there's a violation on her record. If I do a limited, it instantly converts over to a full query, and it tells me, hey, this is now a full query. Megan then has to log in to resolve what's going on with that, to answer the query or whatever. It's a little bit complicated for today's talk, but that's kind of how that part works. Incidentally, if it does go from a limited to a full query, you only get charged once. And if somebody were to ever not consent to a query, they give you the $1.25 back. So it's, there's a lot to that. All right, what does a successful query look like? Boom. So here's what a successful query looks like. You can see about 3 lines down, query result, driver not prohibited. That's what you're looking for. This is a successful query. You can put this driver to work. Changing gears a little bit. Let's talk about CCFs. This has been something, all the stuff we're handling today are a lot of questions that we get asked regularly, and we really want to get out ahead as much as possible. So we actually had one of our competitors put out that, this whole change to the CCF thing with the driver's license number is just a suggestion. It's not. I'll show you in just a second. So keep in mind, first of all, this chain of custody, custody and control form, CCF, COC, it's got 100 different names. It's not changing because it's used for all DOT modes. FRA, FTA, FAA, well, railroad, transit, FAA, Federal Aviation Authority, sorry. Even the Coast Guard uses this form, and actually even the Nuclear Regulatory uses this form. None of those guys have a clearinghouse. Remember, it's just for the FMCSA. So they're not changing this form. The FMCSA requires us right there in line C that you see where it says donor social SSN or employee ID number. The regulations say we shall enter the driver's license, state, and number on that line. Been a lot of questions of how to do it. Every clinic does it differently, and it drives our data entry people crazy trying to match this stuff up. We really, if it's up to us, the easiest format is the 2-digit state and then the number. No dashes, no anything. Don't write on there this driver's license number is. That just, when that gets to the lab, it drives them crazy. And it's required. However, should a clinic do something different, should a driver put it whatever down there, labs and MROs like us still process the result, even if you don't follow that regulation. Now, what penalties are out there? It's not for today's talk, but it doesn't hold up the test if it's not done properly, but that is the regulation. You are required to put the CDL on the chain of custody and also breath alcohol test forms, incidentally. Okay, let's talk about reporting of violations. Who reports what? So if you have a violation, as an employer, you're responsible for reporting all alcohol violations and refusals to test. The common sense litmus test there is, does it go to the MRO? So an alcohol test, there's no MRO review of alcohol. It's strictly from the breath alcohol technician to the DER. So somebody like us who's also a TPA, yeah, because we scheduled it or we paid the bill, we might know about it and we'll help the employer. But strictly speaking, by the regulations, it goes from the technician to the DER. So that's why that and refusals, same thing. There's no specimen. It doesn't go to a lab. It doesn't go to the MRO. Those are the responsibility of the employer. The lesser known job of the employer is something called actual knowledge that we spoke to earlier. That actual knowledge, let's say that a driver has a DUI while they are in their commercial motor vehicle, that is considered actual knowledge, and that's a violation that you should put in there. If you see a driver using alcohol, if you see a driver using, there's special rules on that. Same thing, if anybody out there performs return to duty testing, too detailed for today's talk, but we'll be happy to help you through that if you want. Those are all the employer's responsibilities. The MRO's responsibility are drug violations. That's, anything that we report after the MRO has talked to the donor, determined that it is an actual violation, we report that in the clearinghouse. The only complicated part to this is if a donor stays in the collection site for the full 3 hours, we call it a shy bladder. That's typically what it's called. They have 5 business days to get a medical determination that they had a reason to have that, that they weren't able to provide a specimen. Should they do that, certain things happen. But if they are unable to provide or they don't try to provide a medical determination, it's the MRO's job to report that refusal, because the MRO is supposed to be referring, you work with the DER to determine if they had a reasonable reason or not. And that's up to the MRO's decision at the end of it. That's the only complicated part to the reporting. Again, SAPs have some requirements, but that's out of scope for what we're going to talk about today. Next most popular question is documentation. There's 2 documentation regulations that talk about this. The first one says that you as the employer should maintain the record of each query for 3 years, but then it says this cryptic comment, as of January 6, 2023, an employer with valid registration fulfills this requirement. And that didn't make any sense to us, so we asked the clearinghouse. They said, oh, well, we keep all this. We keep all the records. You don't really have to keep anything. It's all shown right here in the clearinghouse. And we said, yeah. And then we talked to compliance experts, and they said, technically, yes, but there's difference between legal and an audit. They said, you really should keep a copy of those queries. That completed query we showed you earlier, do a screenshot, print it out. Just keep a copy, because same thing as a medical card. Legally, maybe they need it, maybe they don't, but it's a good idea to have it. The other regulation says that the employer must keep a copy of that limited consent form 3 years from the date of the last query. And this is talking about that limited consent form that you do outside of the clearinghouse. All right, let's take another break. Megan, you got any good questions yet?
We sure do. Deborah, I understood that a limited was sufficient for pre-employment unless it came back with violations.
That's not correct. Sorry, Deborah. The pre-employment queries, it actually, if you go through that, when you select the query, you select a full query, there's a checkbox for pre-employment. Technically, the way the regulations read, even the annual queries it kind of reads as though the annual query should also be fulls, but you're allowed to do a limited. So technically you could do a full query for the annual verifications and the pre-employments. Nobody's going to do that, but you do have to do a full query, and it's actually even a third query type for a checkbook for the pre-employment.
And then Don, to clarify, we don't require CDL driver's license because none of our fleet is over 26,001 pounds. Small box trucks, so can we get information from the clearinghouse?
No. If you don't require a CDL, you're not performing safety sensitive information. That is not something that you can reach out to get those violations, or make sure that they don't have anything pending against them. It is strictly for CDLs operating, commercial motor vehicles that are subject to drug and alcohol. So let's say, this is an argument we've had before. I had somebody said, I want to hire this person, let's say, to be a janitor who happens to have a CDL. Can I run them through the clearinghouse to make sure they don't have a violation? No. You only put, if they're going to be doing safety sensitive, that's when you're doing a clearinghouse job.
Is it tied to their DOT number?
The clearinghouse is tied to, and this is a great question. It really is. We've got 3 minutes left technically, so we want to rush through this. The clearinghouse is tied to the CDL number. Now, when you do a report, a refuse report, yes, it goes on your DOT number too, but that's not really what it's tracked for. A driver does not have to be registered in the clearinghouse to put report a violation on them. So anybody that was employed before the clearinghouse took into effect, maybe they're not registered yet, you have a violation against them that the MRO or you can file that violation. They don't have to be registered in the clearinghouse to get there. All right, let's try to jump into really the last topic that we have while we have everybody's time. Going back to the COVID for a minute. Now, data really helps us to be able to see what's going on in the world. And so you've got the CDC, there's 100 different websites. This one we found to be very helpful, to be very informative. And we'll share the website for you. But what it allows you to do is to see the data both in a logarithmic scale and a linear scale. All the linear scales show the data, and this is just a screenshot because we can't put live data on here. But the linear scale always shows it going straight up, and that's probably what you're used to seeing. Once you convert that to the logarithmic scale, and you can see that on the left side, how the distance from 1 to 500 is half the distance to 1,000, and then 1,000 to 5. You hear about this exponential growth. Well, the opposite of exponential growth is a logarithmic scale. So it equivalates and rationalizes the data. So you can actually see over the last few days, we are starting to flatten that curve, you see. But the goal line of that 1.35, that black dotted line, is really our goal. So we're still above it. We still have a lot of work to do before we have a real pandemic on our hands. With this same information, you see along the bottom there, you can choose which country you're looking for. Other screens allow you to pick the state. It's just a really good website. You can even pick whether it's confirmed cases, deaths, or suspected cases, and you can also convert over to that linear scale. So just a plug, we don't even know. This is some computer scientist at the University of Illinois that's put this out, but he shows all the right stuff. His data is coming from the Johns Hopkins information that's updated daily. And best we can tell, of course, we're not really referring him. It seems to be really good representation of the data that we're all trying to deal with.
All right, as you're moving on to your last slide here, got a question from Amy asking about the questionnaire from earlier. We are permitted to use on our employees, though historically no, since this has now been a declarative pandemic. Does this apply to potential new hires as well, though they are not technically our employees?
Yes, this is actually who we designed the form for. Technically, it's for visitors. A potential employee is a visitor. So that is, ideally that's who that's for. If somebody's not an employee of yours, they are a visitor to your site, they can be held to that standard. And so even now going forward to do that. All right, so our last slide, look, guys, we just want to leave you with perspective. This too shall pass. It's not always going to be bad. We all see the light at the end of the tunnel here. We know that it's going to be better. Some days are great. Remember, it's not always going to be good. So just keep in mind, take the world one day at a time, and we'll get through this. If you need anything from us, we're more than happy to help. And thank you very much. Here's our information. Reach out to us. Let us know. Reach out to your different contacts. We'll be happy to get you all the information that you can.
While you're showing your links, let's just remind everyone, this will be available on demand will it be on your YouTube channel?
Yeah, we'll have it on our YouTube channel. Hopefully within about a day, we'll have it on our actual website. We'll be able to, give everybody links out to it once it's recorded.
All right, great.
All right.
What's the website again?
corporatemedicalservices.com.
All right.
Thanks, everybody. And we'll leave you with the links so you can take a look. But again, just you can't click on it here, but this is the references that we've used to create this talk. Thanks, everybody. Bye.
Thank you.
I hope you found the information we presented informative and useful. If you liked what you heard, please subscribe to our newsletter at the link below. We've been monitoring the FMCSA and other publications and have sent out almost every day a summary providing simplified interpretations of some pretty complex changes. It's not a deep dive, but it will keep you aware of all the high-level changes going on that will affect your business. To wrap this up, be sure to follow us on social media for updates and more details. Consider joining us for our Webinar Wednesday series on the second Wednesday of every month, where we spend 5 to 10 minutes giving you an overview of topics that are important to your industry. Also, please visit our website at www.corporatemedicalservices.com. And better yet, send us an email or even give us a call. We look forward to hearing from you. This is Grady Phillips with CMS. Stay safe and well.